Task Force member and coordinator, Provincial Outbreaks Response lead, as well as his day job as Chief Coroner for the Province of Ontario. And so I'll provide some updates, and then I'll leave it if Dr. Hire wants to add any further comments, and of course to answer questions from the media. So it's Thursday. How are we doing? Where are we since Monday? We're looking at the time, it's the peak time when we see effects of the long weekend. And we want to look at how our data is doing, and then what's happening in the weekend coming up. Since our last update on Monday, we've reported 2,302 new cases of COVID-19. That means we saw on Tuesday, we recorded 699 cases. Then on Wednesday, we were up to 733 cases. And today, 870 cases. This slight increase could be attributed to the main long weekend. We also, I'll comment in a moment, of our last data, our percent positivity has come down, but our data may indicate that we may be up a little bit higher again tomorrow, maybe close to 900. So that's concerning as we watch this trend, and hopefully we can turn that around as soon as possible. The current 7-day average for COVID-19 cases is 940 as compared to 1,441 last week. So I don't want to take away from the fact that we have seen excellent improvement in our numbers over the week, but this recent uptick is a bit concerning. Deaths, as we'd like those really to drop down even more, we still saw an additional 44 deaths since Monday. This includes 10 deaths related today, bringing the 7-day average to 15, which is down from 21 last week. And as always, we want to extend our sympathies to the families who have lost and friends who have lost loved ones, because each one is a significant loss to each one of these areas and families. And we would like to have these numbers down to 0 if we could. Hospitalizations continue to be an issue that is showing slow improvement. The occupancy does remain high, and the numbers are steadily improving though. Today, there are 729 people in hospital, and when we note that there's 546 in the ICU, we have to note that of those, there's about 31 that are from Manitoba. That means our number is down to 515. That's the lowest we have been in a while. But that's still a ways to go before we were before, but we do have some extra increased capacity, which is great because we can assist a place like Manitoba that is having real struggles at this time, and we want to be able to help them. In our testing, we saw our volumes, as always, after the weekend, go back up again. We did 34,277 tests were processed yesterday. And the positivity rate, though, stayed down at 2.8%. This is the second day in a row that we've had a positivity rate that low, which we haven't seen since mid-March. The current 7-day average of the positivity is 3.5%, down from 5.5% 1 week ago. On the other side, the vaccines. We continue to see increase in daily numbers. And as these numbers are there, the rates in hospitalization keep decreasing as our immunizations go up, both first dose and now picking up pace on second dose. To date, more than 9.3 million doses of COVID-19 vaccine have been administered in the province of Ontario. That is a tremendous job done, both by those giving, preparing, distributing, all the planning, logistics, and everyone for coming out, by yourself or bringing your loved one or people who need to come out and get their vaccine at the right time and the right way. As effective tomorrow, June the 4th, individuals who receive their first dose of AstraZeneca COVID-19 vaccine will be able to receive the AstraZeneca vaccine. That's just not the ones that were in the 10 to 12 week. This is now 12 weeks, so we have our supply there. But they can also, with informed consent, receive the second dose as an mRNA vaccine, either the Pfizer or the Moderna, if they so wish. So that's what we said we wanted to do, and we've been able to satisfy ourselves with the information materials from our National Advisory Committee on Immunization, as well as from other sources, that mixing the doses is safe. And so we encourage you to do that. And you have the choice between your second dose of AstraZeneca or one of the mRNA vaccines. So combining similar vaccines from different manufacturers in a series is not a new concept. It's been done before. In the past, with our standard vaccinations for children and adults, sometimes they're made by different companies. And sometimes we have a mix between influenza and hepatitis A, for example. So NACI's guidance also advises that Pfizer and Moderna COVID-19 vaccines can also be safely interchanged for the first and second doses. So that's sometimes where, because of supply and flow, you may say, well, if you got one, say Pfizer the first time, and you're in an area that has Moderna being offered for second dose in the right time frame, you could choose to get the Moderna if you wanted to, or wait longer for the Pfizer if you so wish to, or vice versa. So Ontarians who received the first dose of an mRNA vaccine should be offered the same vaccine in the second dose if we can. I mean, I would encourage people to do that, and sometimes waiting another week or so in a timely way with the COVAX system may not be that much of an inconvenience to you. If the same mRNA vaccine is not available, then, as I said, you could substitute it with the other one. And as far as we see from our experts, that does not have any adverse events, and we're assured that the efficacy is closely or approximately the same as if you had the same one. So where are we at? Overall, the trends are continuing to move in the right direction. Our provincial case rate has decreased by 37% for the latest week of full data. That's the week of May 22 to May 28, 2021. And 55.8 cases per 100,000 in the province of Ontario. That is down considerably where we were just a week ago. So this is indeed very good news. The so-called R effective that we've been watching, where we're wanting it below 1 and below 0.9, is now even below 0.8. It's at 0.74. So this is a drop from 0.82 last week. Another indication of the impact of vaccination throughout our communities. Our hospital and ICU admissions still remain up high, and we're still waiting for those to come down, but they are a late responder. And we're trying to see if our hospital admissions are dropping off at a more rapid rate, because that's a better indicator than the ICU admissions, which have to deal with length of stay, which is also increasing. So while these are encouraging trends, as I said, some of our latest data, the last few days, shows a steady climb over the last 3 days. And some of our other data from our syndromic surveillance that we watch has shown an increase recently of our influenza-like illness, which usually in June goes right down fairly low because it's typically low in the summertime. So that's not a big increase, but it concerns me. And I want to make sure we're not moving in a direction where we are just about equivalent where we were in the past, in that trough between the second and third wave. And we're just about at that point now. So we don't want to have a chance of going to a fourth wave. And with the so-called, now called Delta, the so-called variant of the 617, so-called Indian strain, the 617.2, we're getting some data that shows it's fairly prominent in some areas, and we're seeing that. We're still trying to understand how it behaves. What is its severity? What is its hospitalization rate? What is its morbidity rate? What is its mortality rate? We're still trying to get that from other jurisdictions and understand that. We understand it's more transmittable. And we understand that some of our single-dose vaccines, while they might be a protection against severe consequences, still allows transmission. So therefore, we are moving up the pace with the task force to get ahead on the second dose. So that's where we're at right now. We're in this very critical time of seeing if we are going to progress and keep going down and get down below that trough between what we were between the second and third wave, down to those low numbers that would give us a good position to move out into the summer. Or are we seeing a blip due to the Victoria Day weekend? Will that correct itself over the weekend? And can we keep the so-called Delta variant at bay and keep the numbers down as we continue to ramp up our vaccine program that's happening live time right now? And so thank you again for all that you're doing to maintain the measures at this stage, going out to get vaccinated when your turn comes, and for all those who are undertaking to get those vaccines out and around in the many different formats. And I'm excited every time to hear all the different ways we're doing that, to get everybody has the opportunity to get it when they can, when they should get it, and to get both their doses in a timely fashion. So, unless Dr. Heyer has some further comments. Okay, over to you, Dr. Heyer.
Thanks, Dr. Williams, and good afternoon, everybody. Just want to pause from the discussions that we have around COVID on a regular basis, where there are certainly many tragedies associated with COVID, and we've talked about those throughout. But I also want to take a moment to recognize the impact on many, the suffering by families and communities, and express sadness about the tragic information coming from British Columbia that we've all been talking about. It's all associated with the horrible tragedy associated with Indian residential schools, and I don't want any of us to forget that, and to walk together to continue to remember and to continue to help move forward from such a tragedy.
With that, over to the media for questions. Thank you, Dr.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath, from CHCH TV. Randy, please go ahead.
Hi, doctors. You're saying that people that got AstraZeneca as their first choice or as their first dose now have the choice of getting an mRNA vaccine or another shot of AstraZeneca. What should that choice be based upon?
So I'll start, Randy. Thanks for that question, then we'll pass over to Dr. Williams for further. So right now, what we know is we know from clinical trials and real-world evidence that AstraZeneca provides very good protection from illness, very good protection from serious illness, hospitalization, and death as well, and best at the 12-week interval. And so we know that that is true, good solid information about that. We also know from data from the UK, where now over 9 million doses have been provided, that there is an associated risk at about around 1 in 600,000 people who receive their second dose may suffer from the VIT complication. So we know those two pieces of information. We know that mRNA has not been associated with any significant adverse events to this point, certainly side effects at the time of delivery. And what we don't know is the clinical evidence of immune protection with AstraZeneca and mRNA together. The studies are not complete to be able to answer that question. But we do know that when an mRNA is given after AstraZeneca, there's more reaction, so more side effects that occur. So all of those pieces of information are what's present. That we know, I'll summarize, that there is a risk potentially with AstraZeneca. We know that it gives good immune protection. We know that there isn't any significant adverse effects that occur with the two doses together, and we don't have specific data that answers the immune protection that arises with the two.
Follow-up?
When will you have that information so people can make an informed choice? Now, what you just said to me, it seems that the choice should be based solely on blood clotting. And also, if it's proved that the two doses of AstraZeneca doesn't give the same protection as a dose of AstraZeneca and a dose of an mRNA, can people that have already received two doses of AstraZeneca potentially be given another dose, a third dose of mRNA to offer complete protection? Is that a possibility?
Randy, you always set up the plans for what to look for in the future. Thanks for those. So I think in answering the question, we provide the information that we have available to us. The UK are doing a specific study, and there's also studies that are occurring in other locations to try to understand the immune protection that results with them. But it also takes some time to have the real-world understanding of vaccine effectiveness after those doses have been provided. So we're providing the information that we have available right now, and recognizing that it does mean that people will have to think through and have conversations with their healthcare providers and others to think through and make the decision that's going to work best for them. And as we do have additional information, that will allow us to better answer the question that you raised, which is there something else that would be required after? At this point, the early observations, Dr. Williams can add to this, but the early observations are that that's not likely, but I don't think we have that in any definitive way.
Next question. Next question.
Doctors, just wanted to pick up on what the Premier was saying yesterday, that he was cautiously optimistic that there might be a possibility of an earlier reopening going into stage 1 earlier than June 14th. So earlier today, Health Minister Christine Elliott said, maybe a few days. And Dr. Williams, what you were just saying, it doesn't sound like you're ready at this point to recommend that. How do you look at what the Premier has asked, and what kind of shape do you think we'll be in over the next week or two?
So I know the Premier and others are optimistic. We were buoyed by the low numbers we had earlier with the 600s range. This recent rise in the last few days, which is not atypical of what we experience in week over week. A bit more than we anticipated, but we want to make sure this is just a temporary one, maybe related to the Victoria Day weekend. So therefore, the data at the moment is less promising at this time, but we want to make sure we look at it early next week to have an idea of what it might be. So like others, if all our indicators are in a good position, we were looking for the week of the 14th. We like to see if we can improve on that, but it really is down to the numbers. And if I hope we don't have a continual rise over the weekend of more cases getting over 1,000 again. That would be disappointing, to say the least, because we tried to make sure all the measures were in place for the Victoria Day weekend in that. And so let's hope we can turn that around fairly assertively and see if the numbers drop, and then we'll have some better answers for the Premier and the Minister early next week.
Follow up?
And thanks, Doctor. And just to get back to Delta variant, what's the latest situation with Delta? What are the numbers? Where is it strongest? Just looking for chapter and verse on whatever intelligence you have on it right now.
So one of the things we're dealing with the Delta is that we haven't got the same live time surveillance tool that we did with the so-called PCR related to the B117, it used to be called UK, now called Alpha, different names, and with the P1 as well as the 135. So we're having to use whole genome sequencing, which is slow and laborious. And so we're going to have to use some measurements to give a best approximation. So we're getting valuable input from Public Health Ontario in that. And our best measurements would say, with sequencing, we're in the 440 range with what we sequenced so far over the last while, and some go back a number of weeks. So we know it's in, around, and moving. It tends to be concentrated more in our larger urban centers. That's not surprising, as in Toronto and Peel, as well as some other larger urban centers. We've had a few clusters outside as well. And we've had some concerns with an outbreak related to a mine in Nunavut that has spread a number of cases around Ontario. So we're continuing to watch those. With our measurement system, it may be the numbers are probably higher than that. And that's why you're hearing some percents being projected in certain areas as it becomes more increasingly prominent. Some of our percent projections say it moved up from 12% up to 17% and maybe even up to 23%. But those numbers are rising as our volume of tests drop down. It'll be interesting to see what it shows with these higher numbers over these last few days. So I can't give you a precise number except to say it is rising, and we're seeing it more prominent in our large urban centers, as well as it has shown itself around in different areas in the province. So it's not just located, isolated to those ones alone. And we're continuing to improve on our ability to move through the whole genome sequencing as much as our laboratories can expedite that and still doing the quality work. So we'll be updating you as soon as we can with more and more detail, but it certainly has been helpful to get their further analysis on it that gives an idea of that it's maybe more prominent than we had seen, even as the prominent one before, the B117 UK, is dropping down.
Next question.
Your next question comes from David Woodard from AM 640. David, please go ahead.
Thank you very much. I was hoping for some clarity, Dr. Williams. You say that it's a rise in daily case counts, but because there were more tests as well, which resulted in lower positivity rate, is it really higher numbers, or is it just that we're seeing basically, the accumulation of, more tests being done equaling more positive tests.
You're almost listening to our discussions that we have each day. And we ask the same question. If we see the volumes going down and the positivity going up, that would be indicative that we're just not doing enough, or we're not doing as many tests. It's been interesting to us that we're seeing the volumes go down and the percent positivity go down at the same time. And so we're always attentive to that, the point you're raising. Are we getting a good picture or true picture as the volumes go down? Plus, we're going to ask ourselves, how are the hospitalization rates? Are they dropping off as well? And there's other ways to measure those impacts around, because very ill people will still go and get seen. And so I would say that the positivity dropping down, even as the volumes drop down, is reassuring in that. And so I like to see them both go in parallel. So I think you raised a very good point. That's why I said I wanted to see what happens with the numbers over the weekend coming up, to see if the general trend is the same as other weeks, or are we seeing a larger surge due to the Victoria Day weekend in that, to give us better advice for the early part of next week. But thank you for that question.
Follow-up?
Thank you. And on grad parties, Dr. Williams, it seems like it was a bit of surprise to many local public health units and school boards on the Premier's announcement yesterday. I wanted to know if you were consulted on the idea, and if not, do you think it's a good idea to gather students and parents for year-end parties?
So I understand this is something I know that the Premier is very wanting to do, I think, because it's been a tough year for students in general, for all levels. And that's why I think he was wanting to have something for end-of-year get-together somehow for the students for all grades. And that's a major undertaking. In there, I've been, our public health people have been consulted at this time on how might or could that occur. It's a challenging issue to undertake with measures in place at the same time. There are different people that are apprehensive about it. I would depend heavily on the knowledge base of boards of education because you're dealing with unique situations in different areas. I think, as I have in the past when I've had issues at the local level, I really depend on the knowledge base of principals who know their community, who know their schools and know their parents as well as staff on how to undertake that. While it's a good idea, I think there's ways that they might be able to do it that's still safe in that and still meet that kind of sort of end-of-year type activity. I can't see it be the same as the usual ones in the past with the so-called proms and different celebratory events. This would be more of a diploma or a completion time with more restrictions around distancing and masking and spacing. And so there's a lot of logistics to be worked out, and no doubt quite different in different parts of the province and different areas as you deal with well over 2 million students and 5,000 schools. So it's an undertaking that is not taken lightly, but understanding the sense of, for some way to mark the end of the year, at the same time understanding the apprehensions of parents, students, and perhaps staff as well. So it's an issue that we're trying to see how to endeavor to undertake that and to bring all those things into consideration at this time.
Last question.
Your last question comes from Holly Mackenzie-Sutter from the Canadian Press. Holly, please go ahead.
Hi, question for Dr. Heyer. The health minister was saying today that the vaccine task force is looking at moving up second doses for everyone. Just wondering if that means the second dose priority is going to be based on age for everyone now rather than the date of first dose. So just hoping you can explain more about what exactly is actually being considered right now.
Sure. I can't speak specifically to what Minister Elliott said, but from a task force perspective, what we're looking at all times is, with more supply, can we move the second doses forward? And we have a plan to move people who are over 80 are eligible to book right now. And as you know, the next group is the 70 to 79. And then what we've done is we've put groupings together based upon when people receive their vaccine so that we can replicate the approach that was taken with the first doses being provided. And so it's whether we have more supply, we can move those those groups closer or to the left. So it's really compressing the time frame between the first and second dose overall, but it really would be based upon our supply and based upon the delivery to first doses, because we're still balancing first and second doses in a number of areas across the province where the allocations were different and where the populations are different. So it's thinking about things holistically, but thinking about shifting the pieces one bit at a time as we have greater supply and as we know there will be availability for those different tranches.
Follow up, and this is the last question.
So I guess people aren't going to be offered shots based on a different criteria. It's going to follow the same groupings based on dates, if that's what you're saying. And hoping you could also say whether task force is looking at, maybe prioritizing essential workers sooner, as has been also discussed in light of the variant threat.
Yeah, so at this particular point, there's always discussions. Everything with the pandemic changes based upon data and about discussions that we have at the moment. But currently, the understanding that I have is that we are continuing along the replication of the first, which was focused on age and at risk, as we wanted to make sure that those who are at greatest individual risk are provided the earliest opportunity to have the best protection. And then moving from that would be then those who would be at risk by where they live, so congregate settings and other situations, or geographically in the hotspots, and those were all prioritized through the first phase, and similarly they would be moved forward as the dose interval narrows by the tranches of when they were provided that vaccine. So at this point, that's the structure and the strategy that we have, which again focuses on age and at risk.
Thanks, everyone.